Hello, I am Mr. Shrum, and I'm back again with another anatomy lesson walkthrough thingy. And today we're going to look at the muscles that move the wrist and hand. So we talked about the upper arm, where your tricep and biceps are. And we talked about the shoulder joint. And then we moved on down to the forearm. And now we're going to get into the furthest part of your limb, the wrist and hand. So here we have a lot of tiny little muscles and bones. So let's see how they all tie in together. The wrist and hand is made up of carpal, metacarpal, and phalanges. The movements occur at the wrist and finger joints. So if you look at your hands, there's a lot of stuff going on. If you extend your fingers or you close your fingers into a fist, you notice that each knuckle is a joint and they're all working and coordinating together. And the muscles that move the wrist and your fingers are on the anterior side, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, and on the posterior side, the back side of the hand, the extensor carpi radialis longus, the extensor digitorum, the extensor carpi ulnaris. So on the front part of your hand, if you're closing your fist, if you're moving your fingers towards your palm, that will be these, the flexors. And then if you're trying to extend your hand, if you're going from a fist to an open hand, like you're going to give a high five to someone, that's extensors that are opening up your hand. And we'll get into that later. But the anterior flexor carpi radialis, all that is located here in this diagram. And then on the back side, you have all those extensors. So on the inside of your forearm and wrist, closer to your body, that'll be the flexors. And then on the outside of your body, further away from your center, is the extensors. And you can move your hand around and look at your wrist and your bones, and you can notice all of the different things flexing and moving about in your body. It's really strange to think about if you just sit down and watch your body work. But the flexor carpi radialis flexes and radially deviates. So radial deviates, abducts the hand at the wrist. The origin at the medial epicondyle of the humerus, and then the insertion point, the bases of the second and third metacarpals. So do you remember how the carpals and metacarpals are placed in the hand or numerated? We have a certain naming convention, but it's in the name. It flexes, and then it deals with the radial abduction. Palmaris longus flexes the hand at the wrist. It also tenses the palmar aponeurosis, which causes you to make a fist with your hand. So anytime you're making a fist, you're flexing this palmaris longus. And it's also at the same origin point, the medial epicondyle of the humerus, and the insertion is the flexor retinaculum retinaculum of phalanges and palmar aponeuroses. On the anterior side, we have the flexor carpi ulnaris. It flexes and ulnar deviates, so adducts. Remember abduction versus adduction, the hands at the wrist. It's also origin is the medial epicondyle of the humerus, and the insertion is the pisiform hook of Hamate, and then the base of the fifth metacarpal. The extensor carpi radialis longus extends and radial deviates, abducts the hand at the wrist. It originates, or the origin point is the distal lateral end of the humerus, and the insertion point is the base of the second metacarpal. Extensor digitorum extends the wrist and fingers. Digits, think digits and fingers. Extensor extends, so you're extending the fingers and the wrist. The origin is at the lateral epicondyle of the humerus. Insertion, the distal phalanges. Yes, and then on the back side of your wrist and hand, we have the extensor carpi ulnaris. Extends the wrist and ulnar deviates, adducts the hand at the wrist. Origin, lateral epicondyle of the humerus. Insertion, the base of the fifth metacarpal. Movements of the hand include radial deviation, abduction, ulnar deviation, adduction, extension, hyperextension, and flexion. So here we can see radial deviation at the wrist joint. Radial deviation of the hand at the wrist joint is performed by the flexor carpi radialis and the extensor carpi radialis longus. So hold up your right hand and then move your fingers and towards your right. So towards the side with your thumb, with your palm facing you. That is called radial deviation because it's toward the radius. And the ulnar deviation would be the other way. So hold your hand in front of you and then move it towards your pinky side. And that's performed by the flexor carpi ulnaris and the extensor carpi ulnaris. And then we have extension and hyperextension of the hand at the wrist joint. So have your hands up and then bring your palm facing downward. Yeah. Flexion is the opposite way. So we have the palm facing down and now the back of your hand is facing down. So flexion of the hand at the wrist joint is performed by the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. The prime movers of the fingers are flexion, palmaris longus, extension, extensor digitorum. So that's how flexing and extending, those are the prime movers in that case. And here you can see them in the diagram. And that's the end of the wrist and hand section. Let's move on to the last section. And we're going to talk about the axial skeleton. So if you remember how we distinguish between scapular muscles and axial muscles, now we're going to look at the axial skeleton. The axial skeleton is part of the skeletal system that includes the skull, the rib cage, and the vertebral column. Muscles of the axial skeleton perform the following functions: facial expressions, chewing, ventilation, and control of the neck. And these are the muscles that are controlling your facial expressions and all your neck muscles: the epicranius, the Orbicularis Oris, and the buccinator. That's how that one is pronounced. The epicranius is actually composed of two muscles that are separated by the galea aponeurotica. The galea aponeurotica is a broad sheath of connective tissue that you see here. The two muscles that combine to form the epicranius are frontalis and the Acipitalis, located here and here. Frontalis is near the front of your face, and it elevates the eyebrow and wrinkles the forehead. Origin, galea aponeurotica, and then the skin of the eyebrow is the insertion. Now, in the back of your head, we have the Acipitalis. It moves the scalp backwards. So origin point is the occipital bone, the mastoid process of the temporal bone, and then the insertion point is the galea aponeurotica. Moving on, we have the Orbicularis Oris. This closes the lips, forms words, and then puckers your lips as well. It's your kissing muscle, another way to think about that. The origin is at the fascia, deep fascia surrounding your lips, and then the insertion point is the skin of the lips. So anytime you're kissing or using your mouth, think Orbicularis Oris. And then we have the buccinator. It compresses the cheeks, and you use this muscle to suck and blow air. The origin is the maxilla and the mandible. Insertion is the Orbicularis Oris. The movements of chewing and biting are known as mastication. In Spanish, the verb is masticar, so it's similar, right? The root mastication. But think of just moving your mouth, biting, chewing, and the muscles you're using when you chew on food: temporalis, Masseter, and the medial and lateral pterygoid. You can see those here. The temporalis closes the mouth by elevating the mandible. And the origin is the temporal fossa of the zygomatic bone. The insertion is the coronoid process of mandible. Masseter closes the mouth by elevating the mandible as well. It's superficial, so you can see this muscle, the muscle, as you bite down. The origin is the zygomatic arch, and the insertion, the lateral ramus of mandible. Then we have the medial and lateral pterygoid. It elevates and protracts the mandible. And it also moves the mandible laterally, so side to side. Origin point, the sphenoid bone, and then the insertion is the mandible itself. Now we move on to the prime movers of the neck. So we have the Sternocleidomastoid. Sternocleidomastoid. Fun long words to say. Splenius capitis. I'm gonna see. I'm gonna double check this one. Yeah. Splenius capitis, and then the sternocleidomastoid. It's very interesting. Sometimes I don't hear these words out loud for a while. But anyway, this sternocleidomastoid runs along the side of the neck. When one contracts, the head turns to the opposite side. For example, if the right sternocleidomastoid contracts, the head pivots to the left. When both sides contract, the head is pulled forward and down. So forward and down. Origin point is the sternum and clavicle. The insertion is the mastoid process of temporal bone. So think sternum, cleidoid, clavicle, and then mastoid. They just sort of run the words together. Splenius capitis extends the head. It also laterally flexes and rotates the head at the same time. The origin is the inferior half of the ligamentum nuchae, or C3 through C6, and the spinous process, C7 through T3. And I would look at the diagram to remind you where these things actually are. The insertion point, superior nucleus of the occipital bone, and the mastoid process of temporal bone. Ventilation or breathing, right? Breathing is moving air into and out of your lungs. Muscles that aid with ventilation include the diaphragm, the external intercostals, and then the internal intercostals. The diaphragm pulls the central tendon inferiorly and increases the vertical dimensions of the thorax. When you inhale, you're breathing in air, and the diaphragm contracts and makes more room in the chest cavity. When you breathe out, you're exhaling air, and the diaphragm recoils passively upwards. The origin point is the xiphoid process of the sternum, the costal cartilages of lower ribs, and lumbar vertebrae. The insertion point is the central tendon of the diaphragm. The external intercostals elevates and draws ribs together during restful breathing. So when you're just existing, you're not doing anything strenuous. This is the natural pattern of breathing. So when you're inhaling, the external intercostals move the ribs up and out to make more room in the chest cavity. And then during exhalation, the ribs passively return to their starting point. The inferior border of a rib is the origin point, and then the insertion point is the superior border of the rib below. So you see here. The internal intercostals draws the ribs together and depresses the thorax during forceful breathing. So when you're exercising or breathing hard, this is your body forcing you to exhale, right? So external intercostals are on the outside of your ribs mostly. And then here, it's more internal, right? It's in the name. So same type of the origin and insertion, but they're flipped. So the external intercostals starts at the lower border of a rib, and then the insertion point is the upper border of the rib right below it. But this one starts at the superior border of a rib, and then the insertion is the inferior border of the rib above. Okay, so be careful with that. That can be a little confusing. So muscles of the axial skeleton perform the following functions, right? Any type of facial expression, chewing or biting, breathing or ventilation, and then controlling which way your neck moves. These control your facial expressions, epicranius, orbicularis, oris, and the buccinator. Then we have the muscles that aid with chewing or mastication, temporalis, masseter, medial, lateral, pterygoid. And then the two prime movers of the neck are sternocleidomastoid, the splenius capitis. Muscles that aid with breathing, ventilation, your diaphragm, and then the intercostals, both external and internal. Okay, so that's it for that section. I will see you guys next time. And if you have any questions, be sure to message me in Canvas and I will help you out. All right. Thank you. And I'll see you later.